In this chapter, we unpack the difference between 12-step facilitation, TSF, and 12-step integration, TSI, two approaches that sound similar but serve different purposes in clinical practice. 12-step facilitation, or TSF, is an evidence-based counseling approach first popularized through Project Match, a landmark study in the 1990s. According to SAMHSA Tip 35, 2019, TSF involves sessions where the counselor helps the client accept that substance use disorder is a chronic problem, surrender to a mutual help framework, and actively participate in 12-step meetings. The goal is to increase engagement with the recovery community outside of counseling sessions. Let's go through that once more. TSF involves sessions where the counselor helps the client to first accept that substance use disorder is a chronic problem, second, to surrender to a mutual help framework, and third, actively participate in 12-step meetings. The goal is to increase engagement with the recovery community outside of counseling sessions. TSF is effective for many clients, but it has its limitations. It often focuses narrowly on encouraging meeting attendance and building initial motivation, without deeply integrating the steps into ongoing therapeutic work. This can leave some clients feeling that their counseling is separate from their 12-step recovery, rather than mutually supportive. That's where 12-step integration, or TSI, comes in. 12-step integration takes TSF a step further. Instead of treating the steps as an add-on or a referral, TSI weaves 12-step principles directly into clinical interactions, treatment planning, and relapse prevention. It respects the client's autonomy and worldview, ensuring that 12-step ideas support, but never replace, evidence-based counseling. With TSI, the counselor discusses 12-step concepts naturally, connecting them to the client's goals and challenges, incorporates steps-related themes, like moral inventory or amends, alongside cognitive behavioral or motivational strategies, empowers the client to use 12-step tools in daily life, while also working on trauma, mental health concerns, or other co-occurring issues in session. Maintains clear ethical boundaries. The counselor is never a sponsor, chairperson, or representative of any 12-step fellowship. TSI also helps clarify spiritual and non-spiritual pathways. Contrary to popular belief, the 12 steps do not require belief in a traditional higher power. Many people interpret higher power as a personal value, the group's collective wisdom, or simply the support system they build. Counselors practicing TSI avoid imposing spiritual language, focusing instead on the underlying principles: honesty, accountability, humility, and service.